I want to talk to you today about something I think is one of the most misunderstood pieces of the entire neuropathy conversation. And it's not complicated, but nobody explains it clearly. And because nobody explains it clearly, people end up spending years, sometimes decades, chasing the wrong thing. So today, we're going to fix that. We're going to talk about the difference between neural signaling and neural integrity. Now, here's the simplest way that I can put it. Neural signaling is what the nerve is saying. Neural integrity is the conditions that the nerve is in. Now, that's the whole distinction. And by the time we're done, you're going to understand why that difference determines whether people actually get better or just feel better for a little while and then slide right back. So let's get into it. Most people who come to see me, they've already been through the system. They've seen their primary doctor. They've seen a neurologist. Maybe they've seen two. They've had the nerve conduction study done. And then they got the diagnosis: peripheral neuropathy, diabetic neuropathy, idiopathic neuropathy, chemo-induced neuropathy, or whatever label that they were given. And then they were told something like this: there's really nothing we can do, but we can help manage the symptoms. So they get put on medication: gabapentin, Lyrica, Cymbalta, or maybe something else. And sometimes it takes the edge off. Sometimes it doesn't do much at all. But either way, the underlying problem, it keeps going. And when they come to me, they want to know why. Why does the medication help the pain, but my feet still go numb? Why do the symptoms keep coming back? Why is my friend on the same medication and feeling better, but I'm not? And those are fair questions. And the answer to all of them comes back to that one distinction. Signaling and integrity are not the same thing. So let's start with signaling. Neural signaling is the communication function of the nerve. It's the electrical impulse that travels from point A to point B. It's the message the nerve is sending. When you step on something sharp, a signal fires from your foot, travels up the nerve, reaches your brain, and then your brain says, "Hey, there's pain, pull your foot away." When your feet burn at night, that burning sensation, the pins and needle feeling, that electrical shock feeling, that's a signal. Now, it's a corrupted signal, a misfiring signal, but it's still a signal. The nerve is generating electrical activity. It's communicating something. It's just communicating the wrong thing. And that's actually important to recognize. The presence of pain, burning, tingling, it tells you that the nerve is still active. It may be confused, irritated, and misfiring, but it's still firing. Now, here's where people get a little bit tripped up. A lot of treatments are aimed entirely at that signal. Gabapentin, what does it do? It suppresses the signal. It tells your nerve to quiet down. And that's why it can help with pain and burning. It's like turning the volume down on a nerve that's screaming. It does nothing to the nerve itself. You've just changed the signal. You haven't changed the nerve. Now, think about it this way. That's like muting a smoke alarm because the sound is bothering you. The alarm may get quieter, but the fire, it's still there. Now, neural integrity is the structural and biological health of the nerve itself, not the signal that it's producing, the actual physical condition of the nerve tissue. Think about it like a wire. It's a very complex, very specialized wire that's wrapped in layers of insulation that depends on a blood supply to stay alive, that requires oxygen and nutrients delivered constantly and consistently to maintain its structure. When that wire is healthy, and the insulation is intact and the blood supply is adequate and it's getting what it needs, it fires a clean signal. So the communication is accurate. When that wire starts to break down and insulation is damaged, the blood supply is compromised, the signals get distorted. So they become unreliable and they misfire. And over time, they stop firing altogether. In many chronic neuropathy cases, the signal is often not the whole problem. The signal is often the output of the problem. So when you suppress the signal, all you did was address the output. You haven't touched what's driving it. Now, here's why that matters clinically. And this is the part that I really want you to hear. I see two types of patients. The first type, they still have significant symptoms: burning, tingling, pain, and hypersensitivity. Their feet hurt when they put on their socks. The sheets at night feel unbearable. These patients are suffering and they want real relief. The second type, and this group concerns me a bit more, they've been on medication for a while. The symptoms have quieted down and they think that they're doing okay. But when we actually evaluate nerve function, when we test sensation, when we look at balance, when we do a thorough clinical assessment, the nerve is continuing to deteriorate. The signal is suppressed, but the damage is progressing. Now, that's a dangerous gap. The system is built to manage what you feel. That's not the same as addressing what's actually happening. And when what's actually happening goes unaddressed for long enough, the consequences become much harder to reverse. So let me walk you through the progression, because this is something that most people, they're never really shown this clearly. Neuropathy doesn't start with numbness. It starts long before the numbness even began. The first phase is usually hypersensitivity, burning, tingling, that electric feeling. The nerve is irritated, overfiring, generating signals that don't match what's actually happening. You're not touching anything hot, but it feels like your feet are on fire. Then over time, if nothing changes, the nerve starts to lose function. The hypersensitivity gives way to hyposensitivity. The burning transitions into numbness, and the tingling fades. And people often think, it's getting better. The pain is less. But it's not getting better. The nerve is getting quieter because it's losing its capacity to signal at all. That numbness is not relief. That numbness is the nerve going dark. And that's where real danger begins. Because remember, sensation is how you navigate the world safely. It's how you know where your feet are. It's how you detect injury, and it's how you maintain your balance for your independence. When that system goes dark, the risk of falls, wounds that don't heal, injuries that go unnoticed, all of that escalates significantly. So when I evaluate someone, I'm not just asking about symptoms. I'm asking, where are they in this progression? Are they still hypersensitive? Are they already transitioning? Is significant loss of function already present? Because the clinical picture looks different at every stage. And what we do next entirely depends on where they are in that arc. So if integrity is the real issue, we have to find out what affects it. A nerve cannot heal in an environment that is continuously degrading it. Remember, the nerve lives inside of the body, and the body's internal environment, blood sugar regulation, circulation, inflammation, oxygen delivery, is either supporting that nerve or slowly wearing it down. Now, one of the biggest drivers of nerve integrity is microvascular compromise. That's small vessel disease. Nerves have their own dedicated blood supply. Tiny vessels called the vasa nervorum that run alongside the nerve and deliver oxygen, nutrients, and the raw materials that's needed for repair. When those vessels are damaged, the nerve starts to starve. slowly and over years. And as it starves, the insulation breaks down, the fiber deteriorates, and the structural integrity of the nerve starts to erode. So, what causes this damage of the vessels? Chronically elevated blood sugar, vascular inflammation, and oxidative stress. This is why diabetic neuropathy is so prevalent. Not simply because blood sugar is elevated, but because chronic elevation damages the vascular infrastructure the nerve depends on to survive. And here's what most people don't realize. You don't need a diagnosis of diabetes for this process to begin. Prediabetes, metabolic syndrome, and blood sugar variability can contribute to a very similar vascular and inflammatory environment, often on a much slower timeline. So when I'm evaluating nerve integrity, I'm not only looking at the nerve, I'm looking at the entire biological environment that the nerve is operating within. That environment is not a side conversation. That is the central conversation that should be had. Here's what that means for recovery. And I want to be direct about this because I think this really matters and is very important. Signaling changes relatively quickly. When something modulates the nerve signal, like medication, certain therapeutic interventions, you can see symptom change within days or even a couple of weeks. That's because you're shifting electrical behavior, and electrical behavior can respond fast. Integrity, that changes slowly. Rebuilding damaged nerve tissue, restoring the myelin, regenerating nerve fibers, and reestablishing adequate blood supply, that's a biological process. It follows biology and not the calendar. The literature on peripheral nerve regeneration often references roughly about 1 millimeter per day under favorable conditions, though that varies depending on the nerve and the severity of damage and the biological environment that the nerve is in. And favorable conditions means the environment has to be optimized for support to regenerate. Most people with chronic neuropathy, they're not even there yet. The blood sugar is still fluctuating, the circulation is still compromised, and the environment that drove the damage is still present. So before regeneration can even begin, you have to stabilize that environment. You have to stop the ongoing damage and create the biological conditions where recovery is actually possible. Now, meaningful improvement is possible for many people, but the biology is still going to set the timeline. You cannot rebuild a structure whilst the foundation is still being eroded. Now, I want to be clear because I don't want any of this to sound like I'm just dismissing what patients are actually living with every day. Of course, the symptoms matter. The pain matters. The quality of life, it matters. If someone is not able to sleep because their feet are on fire, of course, that matters. If somebody cannot walk from their bedroom to the bathroom without significant pain, that matters. Symptom management, it does have a real role, but the mistake is treating only the signal and calling it treatment. Real clinical work has to operate on both levels at the same time. You address the signaling environment so the patient can function, sleep, and actually live a life. And simultaneously, you work on the biological conditions the nerve actually needs to recover. Those are two different things happening in parallel. And knowing which one you're working on at any given moment is what clinical precision actually looks like. When someone tells me burning is worse this week, I need to understand a few things. Is that a signaling fluctuation? Or is something shifting in the biological environment? If metabolic stability has been off, if blood sugar has been more variable, if sleep has been disrupted, that's likely an integrity issue producing a signaling symptom. Now, same symptom on the surface, but completely different cause and completely different response. Now, that distinction, that's everything. So if you're watching this and you have neuropathy, or someone you care about does, here's what I want here's what I want you to walk away with. Symptoms are downstream. They are the output of what's happening in the nerve. Treating only the output is not treating the problem. Less pain does not always mean less damage. If medication is managing your symptoms, that's not necessarily bad or even wrong, but someone should also be evaluating whether the underlying nerve environment is stable or continuing to deteriorate. The biological environment the nerve lives in is not separate from your treatment. It is your treatment. Blood sugar stability, circulation, inflammation, tissue oxygenation, these are all central to whether the nerve has any capacity to recover at all. And meaningful improvement is possible for many people, but it requires the right biological conditions, the right clinical approach, and enough time for the body to do what the body does. That is what we've built our entire approach around. Not suppressing the signal, addressing the environment the nerve lives in. Those are fundamentally different things. I hope this gave you a clear picture of what's actually happening inside of your body and why the distinction between signaling and integrity is not just academic. It's the difference between managing a condition and actually addressing that condition. If you've been told there's nothing that can be done, if you've been on medication for years and nothing has fundamentally changed, it's worth asking whether anyone has evaluated the biological environment the nerve is living in and ask whether that environment is actually capable of supporting recovery. That question changes everything. If this was helpful, share it with someone who needs to hear it. Leave your questions below. I actually read them, and then we'll see you on the next one.